My name is Brian Teliho. I'm a board-certified psychiatrist. I've been the medical director here at the Atlanta Center for TMS for the past nearly 6 years. TMS stands for Transcranial Magnetic Stimulation. This is a newer treatment that's been available for psychiatric use in the treatment of depression really since 2008. It's a device or procedure that relies on magnetic energy to stimulate the brain in a way to excite areas of the brain that are otherwise, let's just say, underactive in the typical depressed brain. At the same time, it also works to quiet areas of the brain that tend to be hyperactive in the depressed brain. This is something that is FDA approved for individuals who have failed to achieve a satisfactory result from at least one prior antidepressant trial with the medication. However, on average, most of our patients come having failed multiple trials of medications. And for that matter, most insurance companies will require multiple medication failures before they consider reimbursing for the procedure. This is something that is a bit outside the box for most people who are used to getting care for depression or anxiety. It's very different from other forms of therapy. It's very different in that you're not taking a medication or a pill. Most people are used to taking a pill every day to help with depression. This is a procedure that you'd go through typically 4 to 6 weeks, 5 days a week, 35 to 45 minutes a day. So it's something that is a bit time-consuming or time-intensive up front, but the benefits thereafter tend to linger, and the effectiveness of this type of a procedure over a medication is superior. The only procedure or treatment with more efficacy or greater efficacy than TMS is the old standard ECT, or electroconvulsive therapy, or shock therapy that most people know. TMS is certainly more palatable than ECT in that it is an outpatient procedure. There's no sedation or anesthesia required. I need not disable a potential claimant, or I need not disable a potential patient from work. Most of the time, when I have to send someone for ECT, I'm needing to pull them out of work or school for 2 to 3 months, which can jeopardize work or certainly their livelihood. So there are many pros to the TMS. Downsides or potential side effects would include headache. We're stimulating a portion of the brain repetitively over the course of 35 to 45 minutes. At least initially, the first few treatments that can produce a headache in an individual. Individuals are asked to wear earplugs. It's loud. If you've ever had an MRI done, you may be familiar with that tapping sound. Well, this is occurring during this procedure, so we ask that patients wear ear protection during the procedure. There is a rare risk for seizure. There have been over 500,000 TMS treatments performed in this country since 2008, and there are just under 1 dozen seizures having been reported. So although the seizure risk is quite low, it's still there. I should note that a seizure in and of itself is not something that would preclude the patient from continuing with subsequent treatments with TMS. Obviously, it would be an unpleasant side effect, and that's something we'd want to avoid, but it wouldn't be a reason to stop the treatment long term. Though the procedure is only FDA approved for major depressive disorder at this point, TMS can help with anxiety. Typical forms of anxieties being treated with TMS would include obsessive compulsive disorder, post-traumatic stress disorder, and generalized anxiety disorder. There are many studies supporting the efficacy of TMS in the treatment of those forms of anxiety, particularly with OCD. As a psychiatrist, I think it's very important that a patient treat their illness to remission. I've been treating mental health illnesses for over 20 years. I'm still surprised when I see people coming in for second opinions or consultations who are on such and such a medication regimen or who have been in therapy for X number of years, and I evaluate them, and it's clear to me that they're still quite impaired. And many people feel as though they have to settle on getting 50% of their life back, give or take. And my advice to your audience is to respect the illness enough to seek treatment and treat it, but not respect depression or anxiety so much that you allow it to run your life for you. So in that vein, if you are under the care of a psychiatrist or psychologist and you're getting help for depression or anxiety, I would encourage you to remain dissatisfied with your care until you feel you're back to being you. And if you're getting treatments and they don't live up to that measure for you, then keep pressing and looking on and fighting until you're satisfied with the care you're getting and the results you're getting. It's with that philosophy, or because of that thinking, that I initially became more interested in more aggressive forms of treatment like TMS. And I've been pleased over the past several years with the numbers of patients who've come to me with long histories of chronic depression, finding relief and peace, getting their lives back.